Welcome to Unhinged and On Call. I'm Dr. Chelsea, your resident veterinarian.
And I'm Trish, a registered vet tech who's seen it all. Each week, we're pulling back the curtain on the wild world of veterinary medicine, from late night emergencies to barnyard drama.
No filters, no fluff, just real stories, real laughs, and maybe a little emotional damage. Thanks for letting us share the madness with you. Hi, everyone.
Hello. Welcome to Unhinged and On Call.
We're laughing, but we're going over kind of a weird topic today that we think is super important. A little bit of a PSA for everybody out there with horses is I have just, I think ad nauseum, been talking about vitamin E for like the last 3 weeks with people. And what is so consistent between even like my understanding 2 years ago compared to horse owners' understanding now, I think we're at this precipice of like scientific data showing how many things vitamin E deficiencies and even excess affect animals. And then the general public's understanding of like why we need vitamin E.
Right.
And so we kind of just wanted to focus on and run. It's not going to be a funny episode, but
Educational. We're shooting
educational.
for educational today.
Yes. So if you're listening in your car or driving, in your trucks, I'm hoping to appeal, I guess, to horse owners and veterinarians, because a lot of this stuff, like I said, 2 years ago, I didn't know most of this. For whatever reason, the last 3 conferences and then 1 local CE event that I've been to, I've made a point, there's different tracks and stuff, to go out of my way in looking at vitamin E talks essentially and just like trying to get more well-rounded on the subject. And it's like mind-blowing the amount of things that I've probably in my case history, like it's not come up essentially.
Right.
And now I'm finding with testing, like finding so many animals that you're like, oh my, this, including one of my own who is incredibly sensitive. And I can talk about him more later because I've learned a lot with types of vitamin E that you actually have to supplement with.
Right.
That horse doesn't respond to powder.
Yeah. Well, and I'll be sitting down with the class a little bit too, because I think, like she said, she's learned so much in the last couple of years. Like we all have our general understanding of why it's beneficial. Just as horse owners, I think like everyone, we'll get vitamin E in our buckets, and it's common, but also there's so many different things to learn about it. So,
well, and I think for humans, right? You take it, you're like, oh, my skin and nails, so you're
true,
very much when you say vitamin E, there's this connotation that, oh, their coat isn't great. I'm just going to make it better. And of course we want our horses to look nice.
Right.
But this is like neurodegenerative issues that come out of long-term deficiency.
Yeah.
So we'll just kind of jump in with a few different pearls here. Go from there.
Yeah.
And skip forward if you don't want all the information. But we'll, for sure at the end, we'll kind of do some myths, because that's like what I hear the most is people being like, oh, well, I just, I can't do this or I can't do that. And then they don't do anything. And of course, this is, as an equine veterinarian in Colorado, we don't have lush green pastures ever. No. And especially this year, we're in this huge drought.
Especially Colorado, yeah.
We're not going to have any grass this year unless the very select few that have irrigated pastures. Right. I mean, I drive around and I like every once in a while see one irrigated pasture that animals are allowed on. The rest are for hay.
Right.
The second you cure hay in the sun, the vitamin E leaches out. So it's just, it's a very unstable compound. So it's just, we'll go into it. But the reason is that we're seeing this is there's a lot of states, pretty much anywhere west of us, besides like Pacific Northwest, does not have lush grass. And so these horses don't get turnout on it. It's vitamin E is stored in the liver, any excess. And so there's a good study, actually experimental design of, can we induce equine motor neuron disease? And so it's a long study length for horses. It was actually 44 months of not having pasture access to experimentally induce equine motor neuron disease.
Oh, wow.
And we'll go into that disease further. But I mean, it takes a while. So that's also one of those insidious things that you don't, if it takes long, we don't think to look at it, I guess, because it's a really slow decline. It's not super obvious.
Right.
I, for example, just anecdote stuff before we get into it. The mare I bought out of Maryland had been on pasture for 6 months. So I guess maybe like cutting corners a little bit. Didn't test her when she got to Colorado, but essentially in 6 months' time that I tested her, so I knew where she was at. And she was just at the low end, like 299, maybe a little over 300. And our target range, at least through Cornell, and we'll get into this discussion later, there's so many different testing modalities. Michigan's the other main one, and they just changed their whole testing platform. Essentially, they went away from HPLC. And so at Cornell, they still do HPLC, and our target is 300 to 600. That's not what's reported on the reference ranges. Like there's different reported reference ranges. But clinically, especially in like growing horses and performance horses, you need to also be aware that what the test says, which is anything over 200 to 1,000 is actually not a great like cross-referencing, I guess. And in all the, any reference range can be varied and different. But we are looking for a much higher rate than 200, and it's in micrograms per deciliter. So important to know for other practitioners, if you just get your report back in your reference range and you haven't gone and done other CE on this, like 200 is not okay for a performance horse. Okay. Like your muscles and your turnover and all that stuff need more than that 200 rate. So it's a matter of going out and seeking more education. I'd rather have them be at 500, 600. They're going to perform better and feel better at the higher end.
Oh, I'll be testing my horse on Monday. Yeah. Perfect. So my inherent instinct when I get off and I hose him off and I use that time to hand graze in the green grass.
Oh yeah.
It's literally like makes me feel better just naturally.
Yes.
And so that's
as long as your horse is at an appropriate weight. Yeah. Hand grazing is great. Yeah. I will, sorry to deflate your bubble.
That's okay.
I chatted it last year while I was going through all this with my 8-year-old that I'll expand on later. Yeah. I want to say it's like 30 minutes of hand grazing is 15 IUs of vitamin E.
15?
Yes.
Oh, okay. Great.
So you can enjoy, he will enjoy the hand grazing.
I do call it his green cupcakes. So it's like,
and it's like,
treat.
It's bonding time. Like I love
totally,
hand grazing because it just makes, especially in Colorado where we just don't get pasture.
Yeah.
Makes me feel better about the whole thing.
Yeah.
And I'm sure there's other nutrients that they're getting that they're not getting in hay. But it's all really low amounts.
That's really good to know though.
The spoiler of all this is like, if we're treating a low and deficient horse, we're doing 5,000 IUs per day.
Yeah.
So 15 IUs. Yeah. Like I was literally asking Charles, like, how much hand grazing do I need to get to 2,500 IUs per day? And it was like 6 hours. Which is every day. The whole point is they're supposed to be on pasture. Like,
right, exactly.
6 to 12 hours a day in order to keep this up.
Right. Yeah.
And we just don't have grass like that here.
Well, no. Like, and majority of horses are they in a stall or shed run or a paddock or in a dry lot with hay. Like that's a huge percentage of horses.
Well, and the other thing I deal with all the time here is insulin resistant horses and so then, or insulin dysregulation. And so then those horses cannot have the starches that are in fresh green grass. Yeah, like they cannot have those things. Yep. So you have to make sure that you're supplementing. True. Because those horses, you're being really careful about any grass, like even the nibbles around the fence line. Right. Those horses can barely have anything where they founder. And so this is all super important because you have to then supplement.
Okay.
So,
yeah. Good to know, man. I already learned so much.
Okay. Yeah. All right. Stay tuned.
This episode is brought to you by our friends at VetCS, your go-to for veterinarian-developed CBD and wellness products for pets and horses. Founded by veterinary professionals, VetCS offers science-backed formulas made with premium hemp extracts to support calm behavior, joint health, and overall wellness, whether you're in the clinic or out at the barn. VetCS is all about helping animals live better naturally. Want to see what they're all about? Head over to vetcs.com to explore their full line of CBD products.
So our next chunk, essentially, we're going to talk about the ways that vitamin E deficiency will present itself. The really great, easy, short answer of vitamin E excess, is that there's a potential to change their coagulation or blood clotting. And so we don't, even before surgeries and stuff, you don't want to take a bunch of vitamin E because it can delay coagulation. So the interesting thing is, I don't think there's several good researchers. Dr. Finno at UC Davis, she doesn't technically go above 5,000 IUs per day, maybe on a very large animal, like a giraffe. I've seen some people recommend like 8,000 to 10,000 IUs per day. That would be like upper limit.
Wow. Yeah.
Potentially that could be a horse where, because this does happen, where the gastrointestinal absorption is not good. And so that might be a horse that you do more, but you do it with testing. So you wouldn't just like plain give out 10,000 IUs all the time. It's also expensive and volume, it'd be difficult on them. So just think about that. That's the only downside, is that if you're at high vitamin E levels, you could change your bleeding risk. Let's first talk about a disease that we've known about actually for a long time, which is equine motor neuron disease. It is directly, the causation is directly from vitamin E deficiency. If you think about it, essentially the most oxidative muscles actually in the body are your postural muscles. And so what vitamin E is an antioxidant. Yeah. And so for turnover of like myocytes, which are the muscle fibrils essentially, you need to have vitamin E stores there to be able to turn those muscles over. So if you can think about that, postural muscles are all those stabilizers along the spinal canal. That's what allows you, like if you close your eyes, to stay standing and not like have your body make micro adjustments and not be like weak or ataxic where you're actually wobbly. So imagine if your muscles then for a long time didn't have vitamin E to turn over. So then instead of getting stronger, your muscles waste, right? Your muscles are either getting stronger or they're atrophying slowly. The interesting thing about this disease is actually that it's not a super slow onset. It's actually like really fast atrophy. And so I know I had cases like this, and this is like well described as equine motor neuron disease. So this is pretty straightforward. But essentially if you have, this is the one that takes 44 months to induce.
Wow. Yeah.
Then of that pool of horses that they induced equine motor neuron disease in, they then gave proper amounts of vitamin E daily. Only 45% of those horses recovered.
Oh, wow.
And so it's like it's not a just completely reversible scenario.
Okay.
Essentially you're getting, like if you're to do a muscle biopsy, you're going to get triangular myocytes. Larimer had those on his muscle biopsy.
Oh, yeah.
The resounding thing is they get really weak in their posture. And so they actually are neurologic in a sense because they're ataxic and weak.
Right.
The other thing they do will look like elephant on a ball, where they want to take their front limbs underneath their body, hind limbs come up.
Okay.
Essentially just like a circus elephant. Right. And so if you see that stance, I think that's kind of a ringer for this disease. And essentially you're depleting the muscles of the ability to turn over, and then you end up with weakness. And eventually that, as it's named, affects their motor neurons. And so they don't have that stability more. And I suppose, I haven't seen one this bad, but I suppose they could then progress to like recumbency or inability to stand.
Well, that was my next question, is like, how long?
What does it progress to? Exactly. Mm-hmm. And so in this one, we would, if you were like concerned about it and wanted to prove it outside of a serum vitamin E test, you actually do a biopsy on the tailhead. So the sacrocaudalis muscle, which is pretty well, Dr. Valberg, with technically Michigan State, I think is her lab. She has a neuromuscular lab that we send all our biopsies to.
Okay.
And she's great. She has all the instructions on her website with, I want to say it's KER essentially sponsors it. But she has all the videos on how to get these, and that's super helpful. Like I do the non-invasive biopsies fairly commonly in that gluteal muscle. But the sacrocaudalis is pretty well defined, it's on her website, so you can look that up pretty easy. Then we get into the hairier things, which is there's a vitamin E responsive myopathy, or VEM. And that's actually a change in the mitochondria of the muscle. So it's the more like casual, slower form of EMND, which is also kind of hard because it doesn't hit you over the head with a hammer that they're weak. It's just poor performance and like lack of muscle like development. So muscle loss, but it takes a long time. And so it's just one of those things that you don't find easily because there's a million other things that cause muscle loss, like a sore back, like dorsal spinous impingement, joint disease, things like that, where they're not using themselves. They're actually lame, And so then you kind of sometimes, I guess what I'm hoping from today is people think, okay, let's just screen vitamin E.
Right.
Almost like you do like a saddle check once or twice a year, and you maybe check your farrier angles once a year. If you've got a performance horse, we'll talk about all the growing horses, and that's important too. But maybe we screen vitamin E's once a year. on horses in dry areas without pasture access. If you do have any of these, you want to be at the like 600 to 800 level in your target when you're testing. So your serum vitamin E. The rest of the horses fall into that 300 to 600. In terms of recheck timing, the soonest you would do is 1 to 2 months. I usually default to 2 months. That's what I was going to
ask you about the recheck timing. And also, if you did move to once a year testing, probably coming out of winter in your springtime, because then you have...
That's your lowest
they're going to be, right? That. So maybe every spring it's just a part of your spring work.
You're doing all the things. You're doing a dental, or at least looking at their teeth. You're doing other things. So yes, it makes sense, I think, in Colorado for sure to do like a spring test. I do, interestingly, this all comes from Dr. Finno at Davis, who's like championed a lot of this research. She's amazing. We'll talk about this more in depth, but some of the changes you see are irreversible. So we talked about those like triangular myocytes. That doesn't change. So if you did that sacrocaudalis muscle biopsy, that stays that way the rest of their life, even if they're in that group to respond, right, to getting vitamin E orally. Interestingly, I didn't know this before, but vitamin E deficiency actually leads to changes in their fundus. So if you're doing an ophthalmic exam, you actually get this like fuzziness around like near the tapetum, essentially where it goes from the non-pigmented to pigmented tapetum.
Right.
Instead of like a crisp line, you just get what Carrie would call like a stippled appearance. And so that doesn't change either. Like even if you get the horse back, but that's like, I don't know if that's a great screening test because it takes a while to get there, but it's something that like doesn't change. So if you think about it
so you're more chasing slowing progression and keeping comfortable with many things.
But if you're like doing a pre-purchase or, whatever, like if it's a poor doer, I don't know. I guess you could just, it's something to like log
throw
in
the
there.
vitamin E on the pre-purchase.
Start
add
testing.
It to the list.
Start testing.
Yeah.
And then what I like about this is we might as well talk about this now. 2 to 3 days to get the liquid up to their levels. So if whenever I'm testing and screening or have a symptomatic horse, I just put them on vitamin E. Like it's not going to fucking hurt. Like it's not that expensive in the grand scheme of keeping a horse.
Yes.
Just start the vitamin E. And so we do that. Actually, my technician's horse has been suffering with partial paraphimosis for like 2 months. And I was in Florida for a lot of it. So my husband was taking care of it and they figured out this like really cool sling. He's like a 25-year-old appendix horse. And he has Cushing's and we manage that and all that. But this came kind of out of nowhere. And they just said he was like hanging out more with his penis out of his sheath more than they would normally see. And then what they were trying to do is like, they'd ask him, cause he's not a horse that hangs out.
Yeah.
They would like touch him or get close to it and he'd like suck it back up. For a couple of weeks. And then he stopped sucking it back up. And then he really didn't have the ability to, and this is all called paraphimosis, where they just don't essentially have that. Well, it turns out I saw him yesterday and I was like, God, this timeline, like I'm not happy with this. Yeah. Like he did traumatize it. So there was a period, probably 2 weeks in, where there was edema and pain. And he had actually probably stepped on it or kicked it getting up and actually had penile trauma. But all of that edema is resolved. The pain is resolved. He just can't retract. And so that becomes important with cold weather and like bugs. And obviously he stepped on it once, like he could do it again. Going back to my notes, we're screening his vitamin E. We pulled that yesterday. Going back to my notes from Carrie Finno's AAP discussion in November. Or I guess it'd be December. We were there.
December.
In Denver. There actually is an element of penile ataxia with like consistent vitamin E deficiency. And so, I mean, it just presents in all these different ways. But the important thing is if you're gonna, like in this scenario, Liz, my tech, then started Elevate.
Okay, good.
At 5,000 IUs per day starting yesterday. Your blood levels essentially go... therapeutically 2 to 3 days for the liquid to get to the levels they need. So like if I see a big response, that'll be before I get my test results back. When I send to Cornell, it takes like a week to get vitamin E back. The powder and pellets take 8 to 10 weeks, guys. So there's a reason.
Holy cow.
There's a reason that any of the oral powdered versions, even if they're the natural like water soluble vitamin E, is that they actually still take a very long time, but they're labeled maintenance. So the whole point is if you're treating a deficient animal, you do it for like 60 days with the liquid at minimum.
Yep.
Retest, make sure you're at your target level somewhere between 300 to 600 or higher if they've had prior issues or they have weakness.
Okay.
Then potentially you could switch to maintenance.
Right.
But I will say this with Gosh, I learned last year, he will start to look like a trigeminal head shaker. And it's usually in cold weather and usually over winter where he's had less access to grass. So we figured it out this last winter.
Okay.
Tested him. He was at 174. So then I put him on the powder because I'm just like everybody else.
Yes.
I don't want to give a liquid 7 times a week. 7 times a week. I'm not out there. I don't want to ask the barn to do it because they're already doing like a fair amount. Like I do baggies, but liquid vitamin E is not stable to light. Mm-hmm. It's also not stable to air. So then I cannot put it in a baggie. So they would have to like pull it up when they're by his pen and throw it on his grain before he eats. Like I'm not asking, I'm not crazy. Yeah. Right. Yeah. So I did the maintenance powder at 5,000 IUs per day.
Okay.
I was like, you know what? It'll help. Tested him in 2 months.
Okay.
So he has 60 doses of 5,000 IU of powder, the KER maintenance powder.
So 6 to 8 weeks.
I hope I didn't mess that up. It might be KPP, but the maintenance powder, guys.
Okay.
The stuff that's supposed to work, and he went down.
He was what?
173.
Oh.
In 2 months. It did
nothing.
Squat.
Oh man.
So some of this also is just screen and then make sure you get to a level.
Like, because otherwise it's just not true absorption.
Yeah, it's not. And he is. I think he's a GI absorption horse. Okay. And there's certain horses that don't absorb it well. I think there's horses that burn through it faster, is my understanding. Because if you screen 10, you might only find 1 or 2 in Colorado that are low, and not all of them are supplemented. So I don't, somehow they maintain it. Gosh is one where he had the 6 weeks in Florida. The first 2 weeks, he was iffy about night turnout and the grass had not greened up. But he had 4 weeks of green grass all night.
Oh, wow.
And on top of this, I gave him 5,000 IUs of Elevate every single day.
Okay.
Because I was there and I was feeding and I was doing all the things.
Yeah.
And so I was like, you know what? This is giving me my test to see if I give the liquid at the proper dose every day, what is he at the end of 2 months?
Okay.
He was 300.
Whoa. Holy cow.
So he's at the very low end. And he had grass and he had 5,000 IUs a day.
Holy cow.
And when we talk about like how much an owner can do, I'm out there 3 to 4 days a week.
Well, that's a thing. Yeah.
So I have it, to answer your earlier question when you're off air, is I just have it in my grooming tote and I just give, and I'll give a little bit extra because I know he's difficult. But I can tell, like, he'll get to a point and he'll get kind of head shaking. And I'm like, oh shit, I got to like top it up. So like clinically I know his signs, but not every horse is like that. So, but I keep it in my grooming tote and then I just give it right before I ride.
Yeah. Okay.
Yeah.
Huh.
So,
but 4 days is okay.
I mean, it's all
I can do.
It's all I can do.
Yeah.
So I'm giving Lane the maintenance.
Tell my husband I have to go every day.
There you go. I have to do the vitamin
I have to be there.
It is so. I just wish there were. Yeah, I wish there were an easier option for like getting it into them.
Maybe
Essentially,
we'll create one day.
Yeah. Yeah. But I like right now. I'm giving Lane the 7-year-old thoroughbred the powder because I have a bunch and it obviously didn't work for Gosh, but it does work for other horses.
Right.
But it is iffy. So if you're on the fence at all, you treat for 60 days with liquid, guys. Like 5,000 IUs. The maintenance dose is 2,500 IUs. But again, as we're finding out, that is very horse dependent.
Okay.
Like every horse is different. Some horses don't need it.
Okay.
Like I had a horse that was a dead ringer for vitamin E deficiency a few weeks ago, to the point where I probably like just put my foot in my mouth because I was telling these people that I was like, this is what it is.
Yeah.
And I went and pulled blood and it was like 476 or something.
Oh,
it was
wow.
like plenty high.
Yeah.
I'm like, oh, okay, well now, and he has like poor top line. They're feeding all the things, and he's like, he just muscle wise isn't recovering like he should.
Okay.
And so now we're scoping his stomach tomorrow.
Oh no.
But sometimes you're wrong.
Yeah.
You just got to try.
Right.
And the other notable thing that I learned from Dr. Fano is the liquid is the only one that will increase vitamin E levels in the CSF.
Oh.
So if it tells you anything about neurodegenerative problems, vitamin E gets into the CSF, the cerebrospinal fluid. And that can be hard. There's a lot of it's a vitamin, but there's a lot of things that don't cross the blood-brain barrier. Vitamin E is one of them. And that clearly tells you how important it is that it is in the CSF naturally.
Yes.
You have to have good levels of it.
Right.
So yeah, I think the do not use the injectables. It's just like there are cattle ones.
Yes, that's what
with selenium as well, and they just have huge reactions and like granulomas. Like it's just not worth it.
No,
like just stay safe, but try to get your levels.
Okay.
So anyways,
this is great. I'm learning so much. I'm like, yes, nerding out on all of it. It's wonderful
all
though.
The vitamin
it's
E.
So good to know. It's so good to know.
Yeah. I've been saving this part because it's like not a fun thing to talk about. So EDM, so equine degenerative myopathy has been becoming more talked about, and it's like it's kind of like scare tactic-y and not by anybody's at fault. But there's just been enough cases of it now where people are starting to hear about EDM and like we'll talk about it as later changes in behavior and things like that. And we don't know the causation of it quite yet, but there is a role with vitamin E. So interestingly, and I don't know, probably in the last year or two, unless I'm really late to the game, there's an association now with eNAD and EDM. So eNAD is equine neuroaxonal dystrophy. And then essentially like in my notes and whatever, it's just a spectrum to EDM.
Okay.
And so eNAD presents in young horses generally, tends to be those not on grass pastures. And so especially like 0 to 2 years of age, this is a big one.
Oh, okay.
Because technically we should be supplementing vitamin E in utero. So when the mares are pregnant, third trimester is like the big time to be doing the vitamin E. There was a new Bolton study in 2023, and this is going into EDM, but of 100 horses, 73 had weakness and ataxia. Behavior changes were in 69 of those. So the most common thing with EDM is a behavior change.
Okay.
But essentially we're still like, it has a lot of similarities with vitamin E things. There's the changes in the fundus in the horses, the lipofuscin deposits. Those are in 2 out of 10 horses with confirmed EDM. So remember there's 80% that necessarily don't have those lipofuscin deposits. But that's crossover with vitamin E. Like long-term vitamin E deficiency also causes those. So there's definitely like weird things with it, but essentially how it presents is progressive and symmetric degeneration of essentially their like postural instability muscles, with them being worse in the hind limbs. So you'll see like an ataxic horse, depending on the age, things like that. And like vitamin E should be in your head, like towards the top. Yes, of course we have all these infectious things, but those things generally are much more acute, right? Like days, like if you're going to take West Nile or something, or rabies with symmetric progression in ataxia. This is obviously a little bit slower, but symmetric. So versus EPM, equine protozoal myeloencephalopathy. That's a word.
Yes.
Jeez, EPM.
Yep.
Everyone knows that, but that's like the possum disease with sarcocystis. Essentially, those horses are always going to be asymmetric, right? Because those parasites don't eat symmetrically. But vitamin E is always going to be symmetric and progressive. Okay. There's a lot to be known or like found out about EDM essentially, but it runs true that the EDM horses do tend to have a lower vitamin E on testing. Could be their metabolism of vitamin E, like because their muscles are trying to basically like win out.
Sure. Yeah.
But essentially they're having, I think a little bit like in dogs, like demyelination episodes to where the nerve signals don't transmit. So myelin makes your nerves fast.
Right.
And if you take that off, a demyelination, then your nerves are really slow. So your motor movements, everything are slow. And then even your sensory nerves, it doesn't get to those as much. But eNAD tends to be just brainstem. So if we're thinking back to those young horses, if they have no access to vitamin E, like you think about Kentucky where there's like lush bluegrass, whatever, like those horses are never going to be susceptible to eNAD.
Yeah.
Because they have so much vitamin E.
Right. It's just abundance.
But if you have like an event essentially of them being deficient for a while during their growth periods, you get like abnormal herd mate behavior. I just had one the other, a month ago where they're finally like, okay, she's 2. And she was always kind of a new vet for them. She's like, she's 2. She's always been kind of a poor doer. Like her muscle growth has never been great. And she's a warm blood cross. And she just she gets isolated from the herd was her whole thing.
Yeah.
And you pull her out and she's like half there. Like she's just not super aware of her surroundings. She came back crazy low. She's on a dry lot, crazy low in vitamin E. I saw her the other day. She also by all like, I guess detail, had a stifle OCD as well. So who knows like which part, but at the same time, I just saw her like 2 weeks ago. She's several weeks into vitamin E and she's like bright and alert and like she was trotting around, you know what I mean? And she just like her head her head carriage was completely normal. Whereas before she like looked half sedated in her pen with her friends. But like sometimes you just got to pay attention, right? That like these horses aren't behaving like a normal young horse that should be like galloping around the fields, you know, and playing acting like a lunatic and playing and stuff. If you don't have that, like just keep in mind vitamin E in young horses is incredibly important. So yeah, I think that's the big things on that. The testing, like be careful which lab you're getting it from and your reference ranges. Michigan is doing a great job and it's actually more detailed, but we're still like out on reference ranges. And we're recording, it's April of 26. So I'm sure they're working on it to like justify those a bit better. But they were even throwing like Dr. Finno off. So I just stopped testing there for a period of time because I understand Cornell and I know Cornell's results and what my target should be.
Sure.
But I think in the future it's a much more sensitive method of testing. So, let's see, in terms of myths, I guess it would be that like not all vitamin E is the same.
Right.
So I don't know if you remember this growing up, but like we used to give, especially on the East Coast, you give vitamin E and selenium crumbles.
Yeah. Okay.
I don't know if you remember that. Super cheap. Yeah. Like dirt cheap. And the crumbles, like the horses liked them and all that. We're not talking about the combo with selenium because especially like where we are in Colorado, there's actually high selenium areas. Is just you need a natural form of vitamin E. So it's D-alpha tocopherol. Right. There's different forms of
synthetics.
Synthetics and vitamin E, but that's the main thing. And you're not marketing wise, it's really annoying. Marketing wise, you're not going to find an overt synthetic vitamin E. Like they kind of hide that. So what you need to look for is the natural vitamin E. D-alpha tocopherol. And then you want it to say, so like for Elevate, it's 500 IUs per mil. So if I'm treating and I'm giving 5,000, I'm going to give 10 mils a day by mouth. If I'm only doing the half dose, the maintenance dose, that'd be 5 mils per day at 2,500 IUs. Again, you just risk, I don't think it's a bad idea to try powder, but you have to then test. Like you have to follow up and test. And it's just easier, of course. But we at VetCS are coming out with a combined omega oil. So it'll be algae based with pretty high amounts of DHA and EPA for anti-inflammatory properties and just like support kind of the whole body. So essentially fish oil, but it's from algae instead of fish because we all know horses don't eat fish.
Don't enjoy their sushi. They don't.
They're not fish eaters, pescatarians.
Algae sounds much more
herbivores.
Friendly. Yes.
So we're basically using an algae oil, and then what we're doing, because it's oil based already, is adding in vitamin E and the D-alpha tocopherol form into a pump. So what we want it to be easy for barns to do is keep a light sensitive, like vitamin E and algae oil is a bit light sensitive in the proper packaging. And you just right before you feed, you pump one pump per day. And that's your maintenance dose. If you're treating, you could just do 2 pumps is fine. But I think the thing we need to send home to people, I just had a really low young horse, warm blood in work that he was like at 176.
Oh, okay.
And the owners came back and I had lined out all this stuff. And then the owners came back and they're like, but we can't really give it to him every day. And it's young, a young horse, it's kind of a pain in the butt. They're like, we don't want to ask the barn to do it. So we're just going to do powder. Is that okay? I was like, not for right now.
No, not in the beginning part.
We can try powder later, but we're going to do 60 days of liquid and you just do your best to get out there.
Right.
It sucks, but there's 18 junior riders at that barn.
Sure.
Like pay someone $5
for sure.
To just give it, just make sure it gets in the grain. You don't have to the annoying thing is there's horses that don't like syringes in their mouth. Just make sure it gets on the grain. The horses don't mind the flavor. Our product is going to be flavored and unflavored, but just be palatable to horses so that you can just pump it on the grain. But the biggest thing is that it has to be probably within 10, 15 minutes in terms of oxidization.
For exposure after it's out.
Yep. But you'll see like well-managed barns. I wish I could take a picture of them, but I wouldn't want to exploit it.
Yeah.
But they'll have right above their shelves of grain and all that stuff, they'll have all this vitamin E sitting there. And the current way, which is really annoying because it's just, I don't know why nobody's thought of this, but is to find a syringe. It doesn't come with the bottles. Okay. A syringe adapter that you can then use your syringe, but you have to keep all this closed. And so it is super fumbly. Like it's not easy to give. And you're syringing like for one barn that I can think of 16 different bottles of vitamin E because each horse has their own.
Oh, yes. Right.
And so then the syringes are plugging the top.
Just plug the top.
And it's oil, so it like gets everywhere.
Yeah.
You know, I mean, it's just annoying.
Man.
So essentially what we're trying to do with VetCS, our packaging, packaging will be all white essentially, and then you just pump it on. Man. If you see vitamin E natural, whatever, in a clear bottle, don't buy it. It's not going to work.
We're a little more Western down at the ranch in our feed room. So the pump
There's
is
no vitamin E.
Yeah. Well,
the pump is
but
important.
the pump will be is much easier. It's not like storing a bunch of bottles and it's not as easy. Most people like do a lot of things themselves. So I think that would be a game changer for a lot of people. It's just easier.
And even just if you don't want to incorporate your barn doing it, if you're not boarding, obviously that's easy. But the easy thing to do is just give them like 2 handfuls of pellets.
For sure.
Just be Timothy pellets, whatever, in a bowl while you're tacking up.
Yes.
You know, like pump it on if your horse doesn't like
oral
meds.
I can't wait to use our own product.
now that you're so worried about vitamin E.
Yes. Yeah. I am after staying on top of this now.
Yes.
Yeah.
So yes, I think some of the common myths, we were trying to come up with those, is, my horse's skin and coat looks fine. It's not vitamin E. Well, I cannot I've been looking at horses and testing for years, and I cannot tell you, obviously it was just wrong the other day about the skinny thoroughbred. Yeah. Like I thought that for sure was his thing, but it wasn't. Yeah. And he did not have a good hair coat. So, I mean, it's just, it has nothing, yes, it'll help skin and nails, sure, whatever. But it's far more important than that. We're talking neurologic function and then your muscular function and then turnover. Like we're asking some horses, elite and growing horses, like there's a lot of toll on their bodies.
And like you said earlier, irreversible muscle function. So it's something that's so important to stay on top of before. And another myth that we had on there was that, my horse he eats hay. It's in hay.
He eats hay.
Yeah. It's in
that's
hay,
my
right?
favorite.
It
is not in hay, people.
Right.
Even yesterday, my tech's family they actually get into Feed Excel. They've been really good on nutrition. And they were like, but surely he's getting it in the hay. And I'm like, nope. No hay has vitamin E.
Yeah. Yeah.
So just keep that in mind. And there'll be supplements with like vitamin E listed. I think Platinum lists theirs. Sure. And that stuff is fine, but it's all in small amounts. It's not in enough. It's enough for some of those horses that store it well and maybe don't use it as much. There's got to be a consumption part of this because there's no reason. Right. Like in Gosh's case, my horse, there's no reason he's that low. Right. But he must consume more than the average horse or does not absorb it well in his GI. He just doesn't tend to have GI. Wow. Knock on wood. Yeah.
Seriously, we do have a wood table
I'm
right
shaking
here.
the laptop. Knock on wood, he doesn't tend to have GI absorption issues. So there's something more out there. We just don't know yet. Yeah. But I think your best way about it is to screen.
And something we haven't really, just a category we haven't touched on a lot so far is just senior horses in general. Yeah. Right? Yeah. Just your average senior horse. Yeah. Most likely.
Well, if they're not, like say they move from, Kentucky and then they come out here. Yeah. And then they're here for 8 years and nobody supplemented them. Yeah. It is like a very insidious process in most of the diseases that it's like, in their growing stage, they had plenty of vitamin E. Right. And then they stored it in their liver and they had 44 months. Yeah. Yes. to show anything, And even in those horses, I don't think it probably affected every single horse at 44 months. That's a study. So it's easy to look up. But I think there's got to be something more to the picture. There's horses that in breeding or genetically consume more vitamin E. Right. And I can tell you for sure, my horse muscle wise and body wise feels better if he's on I can tell when he's cool. When I've not, like if there's weeks where I've only been to the barn twice, or given it twice, I've been there more or something, but didn't do it. Yeah. Even just going to touch his nostrils and he's like a little more jittery. Yeah. And then he'll actually do head shaking like in his pen when he's really low. Wow. Yeah. And it took me for fucking ever to figure that out. So just so you all know. And it was actually my like lovely barn owner where I board that said it to me. She's like, what about vitamin E? And I was like, oh, that's for head shaking? I don't know.
Right.
But I had just like kind of confirmed. I was like, I guess he's going to be a head shaker.
Wow.
And I just like went down that pathway. And then sure as shit, it's when his vitamin E is good, he doesn't do it at all.
Wow.
So I just think there's all these different presentations, as if ad nauseum we haven't explained it enough.
Yeah.
But just keep it like forefront of mind. If you're not in an area with lush green grass, like you need to be thinking about vitamin E for horses.
Right.
So
cool. So cool.
Yeah.
Well, I learned a lot. Thank you for that.
Hopefully we
it
didn't.
is so interesting. It is interesting.
And
yeah.
Hopefully nobody fell asleep.
No way.
We didn't have any funny stories. No. There's no funny stories.
That's okay.
It's a little off-brand for our podcast.
We need to know these things.
But if you ever, if you have questions, you can reach out to us at the podcast. The website, we have a contact form on the website, but it's unhingedandOnCall.com. So thanks for listening, guys.
Yes. Thank you.
Thanks for listening, everybody. We would really love to have you as a guest on our podcast. So if you have any fun stories to share with us or would like to be a guest, we have a form on our website. So unhingedandOnCall.com. And you just click on the little link there and you can fill out a little bit about your story and yourself, and then we would get back to you. Or you can just email us to chat@unhingedandOnCall.com and just tell us a little bit about yourself. And we would love to have you as a guest.
We also are looking for ratings. So essentially on Apple, Spotify, wherever you get your podcasts, you can rate and review our show. And that would be super helpful in just getting kind of into the algorithm. And then additionally, we are on YouTube. So if you ever want to watch videos, we put more content, like visual content, so pictures, videos, things like that, into the episodes. So we'd love to have you follow or subscribe our channels on YouTube.
Yeah.
Thanks for listening.
Thank you.